Good morning, everyone. We have great pleasure in having Dr. Elizabeth Jospeh with us for our interview for the newsletter of Kerala Society of Ophthalmic Surgeons. She is one of the senior most pediatric ophthalmologists in the state with brilliant academic achievements.
Madam is currently working as Head of the Department of Ophthalmology and Pediatric Ophthalmology at LF Hospital, Angamali. Good morning, Madam.
Good morning to you, Dr. Mahesh and Dr. Malika. First of all, I thank both of you for coming here and spending so much time with us for this interview. I thank the KSOS also for this interview in the newsletter. KSOS was always very supportive to all its members to come up in clinical, professional and even in cultural aspects, as we have seen in the last KSOS conferences. I was in Little Flower Hospital for the more than 3 decades, and I am a pediatric ophthalmologist and strabismus. I am extremely happy to share my experiences with the viewers of the KSOS. I don't think I have done anything great in ophthalmology, but still my humble experiences I will share with you all.
Greetings to all of you. I am Dr. Elizabeth Jospeh, Head of the Department of Ophthalmology, Little Flower Hospital, Angamali, in conversation with Dr. Mahesh Gopalakrishnan and Dr. Malika. Dr. Mahesh Gopalakrishnan is the head of the retina unit, Giridhar Eye Hospital, Ernakulam. He is a very famous vitreoretinal surgeon, nationally and internationally very renowned. Dr. Malika is a great academician. She is a professor and head of the department at Medical College, Amblyopia. I started my postgraduate training in Medical College, Calicut in the 1980s. Then Professor Venugopal sir and Professor Venkatachalam sir were heading the units, and I am extremely grateful to both of them for imparting a great knowledge and academic skill to me in my which was very useful in my profession. And at this point I very gratefully remember all the teachers and friends, colleagues of Medical College Calicut at that time. I would like to share this very rare picture of my student days in Medical College Calicut. You can see Mata Ishanti sir, Padmaja, Indira madam, Radhadev madam and others in this picture in the 1980 Calicut Medical College. After the PG training, I joined the famous Little Flower Hospital, Angamali in 1985. Then the legendary Padma Sri Tony Fernandez sir was heading the Department of Ophthalmology, and he has given yeoman service to me and many other ophthalmologists in their training, and he has done so many surgeries and is very famous by himself. And I am extremely thankful to Tony sir for teaching me many surgical procedures, including cataract surgery, intraocular lens implantation, trabeculectomy, keratoplasties and strabismus surgeries. And he is a legend by himself, and all thanks to Tony sir. At the same time, Dr. K.E. Eapen and Dr. Itera were holding the retina units of Little Flower Hospital, Angamali. They were the first retinal surgeons of Kerala, and very famous and very able, and I am extremely thankful to both of them. I would like to share a very unique picture. You can see the large queue and a large crowd of people waiting before the ophthalmic department of Little Flower Hospital in the 1980s. Those times the eye hospitals were few in number. Eye surgeons were far less than the patient demand. This was a common sight those days, and we used to travel the length and breadth of Kerala conducting operating camps in far distant schools. This is a picture in which we have converted a school classroom into an eye theatre, and you can see Dr. Tony and Itira sir operating on patients lying on school desks, and the benches are used as an operating chair. There is no operating microscope. People are operating with the torchlight illumination. This is the bygone era, and now a history will be very interesting to the youngsters. And this is preparation of an eyeball for corneal transplantation. There is no microscope, just the operating loop. Those were the times of 1980s. And from that time, the Little Flower Hospital had a facelift, and now the department is functioning in this new building. Tony sir and the management of Little Flower Hospital was keen to do so many continuing medical educations, and this is Tony sir doing some teaching program, and you can see Dr. Narayanakutty and late Dr. Jayant along with me watching. And we used to travel for all India ophthalmic conferences and Kerala state conferences. In this photograph you can see the young Dr. Sai Kumar, Dr. Paul Matthew, Dr. Sashi Kumar, Dr. R.R. Verma, Dr. Sajan, Dr. Joji Joseph, Dr. Radhakrishnan, myself and late Dr. Gopinath. And I was lucky enough to have a short international fellowship. I did a pediatric ophthalmology training in Sydney Eye Hospital, and these are pictures with the professors there, Professor Frank Bilson and Professor John Grigg. After coming back, I started the first pediatric ophthalmology and strabismus department in Little Flower Hospital in 2005, and this is the inaugural picture. Dr. Mohan, Dr. Tony sir, Itera sir all looking on, and we had several strabismological conferences after that. The president of Strabismological Society of India is there, and you can see the very famous strabismologist Dr. Vijayalakshmi madam, along with the Shobhana madam, Sugana madam and many others in the crowd. We were also associated with programs of Vision 2020, and this is a photograph of the Little Flower Hospital staff along with the prominent alumni members. In the sitting middle row you can see Professor Andreas, myself, Itire sir, Mary Kuriakos madam, Tony sir, Epen sir, Mani sir, Father Marden, Radharamanan, Dr. Thomas Cherian sir, and then there is Dr. David, Dr. Ashok Nadraj, Dr. Binu Balan, and Dr. Remya, Dr. Girija, Dr. Leland Bhatt, Dr. Sanita and many others. We were very much understanding, and we had a very good professional relationship between each other. And these are some of the very famous medical college professors with their postgraduate students. You can see Professor Mahadevan, Professor Mary Kuriakos madam, Sahasranam sir, Charles Karia sir, Venkatachalam sir, and Andreas sir, V.K. Raju sir, and you can see the PG students with their professors. Dr. Laila Mohan is there, and Dr. Rajagopal is there, and many others. And we were great friends and colleagues. Dr. Renjini, Dr. Girija, Dr. Meena Sike, Dr. Ani, Dr. Mani, Dr. Thomas Cherian, and all were great friends and colleagues. After this short recollection of history, I would like to do a small update on pediatric ophthalmology and strabismus. This subspecialty of ophthalmology is a very rapidly advancing subspecialty. New strabismus surgical procedures are evolving, many new procedures are being developed, and the existing procedures are changing, and we are periodically updated, and this is an attempt to present some of the latest thinking in pediatric ophthalmology. See, strabismus can lead to amblyopia and loss of vision, especially of one eye, but beyond that it is a disability and cosmetic hindrance, and those people with strabismus is unable to maintain an eye contact, which is very important for the social functioning. So once we correct the strabismus, we are not only correcting the vision but also the entire personal behavior of the patient. Recent advances in strabismus are mainly concerned with the new imaging techniques, new surgical procedures, and change in the management of amblyopia. Despite decades of preschool vision screening, amblyopia is still the leading cause of monocular preventable visual loss. The idea is to detect amblyopia when it develops and not when it is established. Binocular approaches to amblyopia has come. Treatment tools extend beyond patching. We should use binocular integrative activities, and recent advances include computerized therapy and iPad activities. The future is eliminating amblyopia. We have to have pediatric vision scanners to detect the absence of bifoveal fixation, so that we can pick up a person before development of amblyopia. That is the future of management of amblyopia. About imaging also, there is a high resolution MRIs and dynamic MRIs have done a long way in detecting the cause of the extraocular muscles. ASOCT and UBM also is very effective. I would like to show one picture of ASOCT where the extraocular muscle is delineated by a dark shadow between the muscle and the sclera, and the insertion can be measured from the limbus by an inbuilt caliper in the machine. This is very useful in strabismus resurgeries where details of previous surgery is not available, and also in primary surgeries to locate the muscle in conditions like high myopia, muscle aplasia, trauma, etc. So also in postoperative cases where you have lost muscle or slip muscle, this ASOCT or UBM is very useful. Now we can address small deviations. Mini tenotomy and partial tenotomy are two new procedures to address small deviations of the range of about 8 prism diopters. This is the Kenneth Wright's central or mini tenotomy, where central portion of the muscle is cut and allowed to retract. This is partial tenotomy, where either the lower part or the upper part of the muscle is disinserted, leaving a little bit of the muscle in position, so that a little bit of retraction of the muscle will result in correction of a small angle squint. Nowadays muscle plication is more often used than resection. Plication, you fold the muscle on itself with this absorbable suture and fold the muscle, and the sutures are passed in front of the muscle, and bites are taken on the sclera, so that the muscle is fixed on a fold, and this is a reversible procedure in the immediate postoperative period. The main advantage of plication over resection is that this is atraumatic. It does not interfere with the blood supply of the muscle nor the nerve supply. So the muscle plication is more and more popular nowadays, and resection is almost given up nowadays. That is an update regarding strabismus procedures. And this is a child who underwent plication for an residual exotropia. We did the plication of the left medial rectus muscle, and on the postoperative day there is a small muscle bulging there, but that is not cosmetically important. And the pulleys, that is the birth of a new concept. Muscle pulleys have been developed, described by Joseph Demer and group, and now because of the availability of high resolution MRIs, we are able to detect pulley abnormalities. And pulley posterior fixation is a new surgery which is indicated in AV patterns without oblique overaction, convergence excess esotropias, partially accommodative esotropias, and to augment maximal recessions. Duven's retraction syndrome also has advanced so much. Nowadays, to address the defective abduction in Duven's retraction syndrome, we have several transposition procedures. Previously, we used to do partial transposition of both superior rectus and inferior rectus, but nowadays we are more of doing superior rectus transposition to lateral rectus to correct the abduction deficit. There is the Nishida's procedure, which is a new advancement. The Nishida's procedure also correct defective abduction. Y splitting is there for a long time, that will correct the upshoots and downshoots. See, this is a child with left Duven's retraction syndrome, primary position esotropia with absence of abduction. The child underwent medial rectus recession with the superior rectus transposition to the lateral rectus, and you can see that the primary position, the esotropia is corrected and abduction has improved from -4 to -2. So superior rectus transposition is a good procedure. It does not produce any vertical muscle imbalance. Another procedure for Duven's is the Nishida's procedure, in which without disinsertion of the superior rectus and inferior rectus, sutures are passed 8 millimeters behind the insertion of superior rectus and inferior rectus, and then they are brought temporally towards the lateral rectus and fixed to the globe 10 millimeters from the limbus. This is the Nishida's procedure. So, by this procedure there will be a creation of an abduction force, and the defective abduction is well taken care of. That is a very good procedure nowadays, very popular. I would like to conclude this talk saying that strabismus has now less cumbersome procedures, more effective treatment, and now we can address more problems than in the past. I would like to thank Dr. Arup Chakravarti, President of KSOS, for this opportunity, and thank you Dr. Mallika and Dr. Mahesh for the interview. Thank you all my teachers, all my friends, colleagues in ophthalmology. Greetings to all of you. Thanks again.